Okay, perfect. Welcome, everyone. Thank you so much for joining us. We are going to have our second Be a Hero, Make a Plan campaign. So to start, we wanted to go over some quick housekeeping. If everyone can mute their lines, unless you're called on, enter any questions and introductions into the chat. And if you're able to, please turn on your camera just so we can see your faces and it won't feel like we're speaking into the abyss. And some of our objectives for this call, we're going to go over what a care plan is. We're going to go over how exactly you can participate in the campaign. And of course, we want to reserve a decent amount of time to hear from you about ways that you would like to engage on the campaign, what you have done in the past, and what you plan on doing in the future. So with that, I'm going to go ahead and pass it over to Melissa to get us started.
All right, hello everyone. I hope you guys can hear me. Give me the thumbs up if you can. Great, thank you. Hello, and yes, welcome you all for just joining us this afternoon. I know we've seen a lot of you recently because we've had our regional calls just last week, but we're super excited to kick off our Be a Hero, Make a Plan campaign. And my job today is to describe to you why care planning is so important to National Patient Advocate Foundation and why we are doing this campaign. But before we go into those details, I just thought we would just start with a definition with what is a care plan? So a care plan is a guide that allows you to always have a say in your healthcare in the event you are unable to speak for or take care of yourself due to a medical condition. And we really see that at NPAF that there are different levels to care planning. It can be as basic as making sure you have what you need to take care of yourself, such as having health insurance and knowing where to go get support if you get sick. But care planning can also involve more advanced steps to make sure others have what they need to take care of you when you can't. So what does care planning involve? It involves thinking about what matters to you as it relates to your health and well-being. So that's your priorities, your goals in life, concerns you have. Some examples we'd like to give are like, are you a parent? Do you want to be a parent someday? Do you love to go fishing? Is it important for you to stay as independent as you possibly can as you get older? What are those things that really matter to you? And the other part to care planning involves communicating that to the people who matter, so your loved ones and your healthcare team. And we know that's sometimes a lot to consider. So we've actually created a new care planning guide that I'm going to walk you through shortly. But just some quick tips here, what a care plan will do. It will allow you to always have a say in your care. It'll provide you with the confidence and comfort, provide confidence and comfort to your loved ones because they understand how to honor your preferred care. And a care plan will help your healthcare team feel more equipped to provide you with the kind of care that meets your preferences. And I mentioned that, care planning can be pretty daunting for a lot of people to think about, but we just feel that it's incredibly important. And so we actually created this new care planning resource, this guide, to walk people through what it is that they need to be thinking about as they start their care plan. And so our guide includes step-by-step instructions, worksheets to help you think about what matters to you, identify your backup person or your healthcare proxy, as well as caregivers who you might need to call on, as well as a worksheet to plan for your health and any sort of unexpected events. So I'm actually gonna stop sharing this PowerPoint and see if I can actually just share my, my screen, my desktop, so you can have a chance to look at our new guide. If you can just bear with me one moment. All right, so let me escape there. Sorry, you guys are seeing everything. So if you go onto our website, under patients and caregivers, click on care planning, it'll direct you right to our new care planning guide. There's a button there, and we also have just updated information and resources about how to start a care plan. If you go down or download our care planning guide, it'll take you to this page here where you can click on the or just fill out some information and then click download, and it'll take you to this this guide right here. So can we talk about care planning, a guide to starting your care plan? And this is a resource we are incredibly proud of. We put it together with the help of actually a lot of our volunteers, getting feedback from them, as well as just the experiences we know that people have when it comes to just planning for their care. So it's a pretty substantial resource. It's 13 pages long. If you've seen our insurance plan guides, it's very similar to that, but this again is more focused on how to get started with your care plan. So I'm just quickly scrolling. I think you all should just take the time and read it more carefully, but here are the step-by-step instructions that we have outlined to help you get started with your care plan. So writing down the things that matter to you, as I just indicated, identifying your backup person and your caregivers, and actually making a plan and sharing your plan with the people who matter. And throughout, we have tips, a checklist, and just prompts to help you really gather your thoughts. And what I also love about these worksheets is you can either print them out and just write in your responses, or you can, just type in what, write on the PDF or the guide itself, what your answers are to some of these questions we have outlined. And so our first worksheet here is, focused on what matters to you. And we have 5 questions that just outline, things that we think people should consider beyond just, what happens to them medically. Like what are the 3 things that bring you joy, strength, or comfort? And listing those here. What are your biggest worries about your health care? Identify up to 5 keywords or phrases that sum up what you think is important for your quality of life. How do you prefer to get information about your health? And in order to provide you with the best care possible, what 3 non-medical facts should your doctor know about you? So those are just those are the questions to the first worksheet. And then I won't go through all of them in detail, but the second worksheet, again, just gives you some prompts and things to think about when it comes to, choosing who your backup person is or your healthcare proxy, as well as your caregivers, and knowing that, if they're given a heads up to know that they'll, take on this role for you, it won't be such a stressful situation if you do find yourself to be experiencing a medical emergency. And then worksheet 3, again, is more specific to planning for your health and the unexpected. And as I mentioned earlier, we've talked about how we think that there are different levels to care planning. So we start with just outlining primary care planning, like, do you have insurance? Do you have a primary care doctor? And, recording that information down so that your backup person, your caregivers have that on hand. And then we also include intermediary care planning, which we think involves, preparing for the unexpected with your daily life in mind. So just taking account into like the actions that you do every day that you might need help with if you're in a position where you can't do those things yourself, where like going to the grocery store and shopping for food, or taking care of your lawn. And so we have we have a quick worksheet here that just identifies those really important tasks that keeps your everyday life running, and who would you want to take care of those things if you're in a position to no longer do those things. And then advanced care planning, of course, is, all the things that we've outlined just lead to this, part where you can, complete an advanced directive. And we have resources to prepare for your care, and some other organizations who have a lot of their own worksheets or their own tips to completing an advanced directive. And so really that's what this guide is. We have a frequently asked questions because we know what we've heard from you all as our volunteers is, how to describe this to somebody, to let them know that, they don't need a lawyer to start a care plan. Anybody can do this. And then we close it out with just care planning resources that, people can just easily just find what it is that they're looking for as it relates to just, having the conversations and, any other support tools that they might need. So let me stop sharing there. Let me bring back my PowerPoint. Yeah, so I'm just going to pause to see if there are any questions about the resource, our new care planning guide.
Melissa, this is Tony, and I'm sorry I was late. I was tied up with a patient, but I do have a question. When you went through that, and I caught the tail end, are you connected at all with triagecancer.org?
We are
you
not.
familiar?
No, I'm
Okay.
not.
All right. I have found their assistance with a lot of the like the care plan type, like your advanced directives and everything, just the information that they've got has been outstanding. So yeah, and I know it's cancer focused, but it's been a great resource for me to share with patients.
Yeah, and that's so good to know, Tony. Thank you for bringing that up. And, I mentioned, I know a lot of other people here on the call are plugged into other groups who do a lot more work around advanced care planning. And we know that there are so many more organizations who do that. And that's why our focus was more on like, we know advanced care planning can be very daunting and overwhelming for a lot of people, but there are steps that people can take right now to make, to still prepare for the unexpected that isn't an advanced care plan or an advanced directive, but it could eventually lead to that. And so for us, we really view our guide as a precursor or a prequel. I think that's what Rebecca likes to call it, to the more advanced care planning stuff. So we invite you all to take a look, to go on our website, download our care planning guide, take a look at it, complete it yourself, and share it with others who you think would benefit from that. And we've also, I think some of you are aware, we've started to build out Can We Talk resources that are focused on just providing patients, caregivers with just tips to, how to talk with their doctors about their, needs and their priorities, or our other Can We Talk resources focused on telehealth. And of course, now we have our Can We Talk About Care Planning. And so we're really beginning to build this a bunch of resources focused for patients, all under the Can We Talk moniker. And these are also available on our website. You can see those in the Can We Talk section. And so just wanted to put a plug there because we just had them all recently polished. But yeah, I think those are, really, I just wanted to walk through what our new care planning guide looks like, this new tool, because we think it's going to be just so incredibly helpful for so many people. And that's really the biggest part of our Be a Hero, Make a Plan campaign, is to have you share this resource. And just to give a little background again before turning it over to Mary to walk you through what we're going to have you guys do for this campaign. This campaign was born last year because of the COVID-19 pandemic, where we saw so many people end up being hospitalized, people who were healthy, people who didn't expect to be in a situation where they would be hooked up to a vent. And it just underscored the importance that anyone should have, could do these steps to prepare and make it easy for their loved ones. And so we've really just think this is incredibly important. The tagline we've been saying here is that care planning is as important as enrolling for health insurance. And so, this is something we're incredibly passionate about, really excited for. And so I'm going to turn it over to Mary to walk you through the steps of what we would like you guys to do as part of our campaign.
Thank you, Melissa. Yeah, so as Melissa was saying, we want to make sure that we are more intentional with who we are doing outreach with. So our target demographics for this campaign is every human on earth, but more specifically, patients and caregivers, young adults, and the underserved population that we have. And we want to make sure that, we are understanding exactly what everyone's needs are, where they're at. So if you're a young adult, you're turning 26, it's one of the first steps to care planning is going to be, I need to figure out how I'm going to sign up for health insurance and how do I determine what my needs are? How can I plan for the next 12 months before re-enrollment comes around? And so, of course, we have our ACA guide. So we really just wanted to make sure that with this campaign, we hit the mark on identifying exactly what the needs would be and make sure that, as Melissa said, it's not going to be as daunting as it sounds. And there is a care plan for everybody, regardless of where you may be age-wise, regardless of condition, whether you live with a condition or you don't, or you're a caregiver. We just want to make sure that it speaks to everyone. So with that said, our overall campaign goal is to normalize care planning for all of our target groups. And one of the best things that you can do for the campaign is share our care planning guide. I'm really happy Melissa went over it. It is very, very detailed, and it'll give you so many ideas as to, oh, you know what, I never really thought about making sure that my emergency contact or my caregiver or my primary care physician knows how to take care of me. I never told them how I would like to be taken care of or how I'd like to be treated in a serious medical event. So that's one thing that we believe everyone can get on board with, is making sure that the care planning guide is shared and that everyone understands the importance of planning for both anticipated and unanticipated health circumstances. So with this campaign, we have 3 different levels of actions. So you can be a sidekick, you can be a hero, or you can be a legend. All of these things that we're going to go over are detailed further in our campaign toolkit, but we're going to go over a little bit of what each of these different levels entails. So with the sidekick action, make sure you follow us on social media. Join our Tuesday Twitter chats, which begin in the middle of the month. So Tuesday, April 13th, and the following 2 or 3 Tuesdays afterwards, we're going to be hosting live Twitter chats about care planning, and we will have a topic. So once you download our campaign toolkit, you can certainly reach out to me, and we will also receive weekly email updates for the campaign, where you will get access to the topics ahead of time and the questions that we're going to ask. So if you want to be a little bit more thoughtful with your responses, if you want to be more top of mind with some of the questions that we ask, we want to make sure that you are prepared in whichever way you feel the most comfortable. And of course, what we're going to start doing with our campaigns this year is make sure that we have a dedicated week of action. So from Monday, April 12th to Friday, April 16th, we are going to have specific actions you can take every day. So it starts off with creating a care plan, and you can share on social media why you're creating one or why it's important to you. And we do have some sample social media prompts in our toolkit. You can join our Twitter chat, which will be Care Planning 101 on that Tuesday. Share resources with 3 people. If that's a sibling, a parent, a neighbor, 2 friends of yours, share it with whoever you believe could most benefit from this. Help one person you know create a care plan. And of course, we want to honor Healthcare Decisions Day on the 16th. So we will have a downloadable graphic, which is right to the right of the screen, where you can write in why you're making a care plan and use the hashtag #BeAHeroMakeAPlan. And of course, we have other actions that you can take throughout that month. So our next level that we have is the hero level.
Oh, just one thing I wanted to add, Mary, before we went to the hero level. In addition, for that Healthcare Decisions Day action where you download the graphic, we want you to complete it and take a picture of you holding it and post it to social media. And what we'd love to see is just this groundswell of our volunteers, other people talking about, that they started a care plan. Again, this is part of National Healthcare Decisions Day, which is also a campaign in and of itself. But we wanted to, take advantage of the opportunity. So that's something we would love for you all to participate in.
Yes, of course. And with this content calendar and the dedicated week of action, this certainly isn't a restricted engagement timeline. We just wanted to make sure that we provided everyone with an opportunity to feel a little bit more connected, because a majority of us are at home or we have limited hours at work. So we just wanted to make sure that everyone sort of gets that community feel, even if it is digitally or through a screen. So we just wanted to make sure that we provided you guys with something that was a bit more fun. And the next level that we have is the hero level. So with this level, you could share our resources and share your story. So with sharing our resources, just share the care planning guide with friends and family. You can ask employers or small businesses in your community to share a care planning guide with their employees. And we also have sample email scripts in the campaign toolkit as well. And you can ask organizations to post our care planning guide on their website. So we also do provide some tips that you could mention to small businesses and employers. One being, if you wanted to connect with your personal HR department, you can suggest that when it's time to enroll in healthcare coverage, if your employer offers that, if they could have a small workshop or include in an email update for them to fill out a care plan, and can link to this just to make it a little bit easier for them. And of course, we would love for anyone to share their story with care planning. There's really no specific criteria that we have with sharing your story, whether it's a short 30-second video, 2 minutes, whatever you're comfortable with. We just want to make sure that we're capturing all elements of this shared experience that many of us are going to be having at some point in everyone's life. We're all going to be caregivers, or we're all going to be patients. And that's an experience that may happen earlier for some, or later for others. So we want to make sure that we're sort of capturing different moments in time, different aspects of the human journey with this care planning. So we would love to hear from anyone. If you're 25 years old and you are helping your parents with that, or if you're 75 and this is your 3rd time creating a care plan, we want to hear from you. And our final level is the legend level. So this level is interesting. So we would want you to launch your own local campaign digitally, of course. You can host a virtual workshop and also do some phone banking. So with the virtual workshop, of course, there's no, required amount of people that we would want. If it's one person, that's an entire life that you've just helped for the next however many years to come. If you want to connect with a local organization and get on a virtual workshop with their employees, with the people that they may be of service to, we would encourage that. And you can certainly make it as creative as you want. So if you want to call it coffee and care planning, cookies and care planning, you can also have sort of that community element, and you're doing something fun while creating a care plan, just to make sure that we're adding in that normalizing element within care planning. It should be a casual conversation. It shouldn't be so scary. So we want to make sure that that is definitely a selling point for people to join the virtual workshop. And of course, phone banking. So going back to connecting with local organizations, you can just create your own phone banking list of 5 groups or 10 people, however you want to split that up, and just have a conversation with them about care planning. Introduce yourself, how you're related to NPAF, and just sort of get into some of the topical details of the campaign. And of course, we also have sample scripts for you in that regard. So if you are interested in reaching the legend level, we have a call specific for that. We have our legend training next Thursday, the same time, 4 p.m. Eastern, 1 p.m. Pacific time, to sort of walk you through the process of the legend level. So now we would love to hear from all of you and get an idea as to how each of you would like to engage with the campaign. Some of the key dates that we will have coming up, or maybe we should hear from you first before we get to the other stuff.
Yeah, and actually let me, Mary, I think I will just share my screen so people can see where to, can you still see my screen?
Yes.
Okay, so you people can see where to find the toolkit. We can also drop a link in the chat, but going onto NPAF's website, npaf.org, to volunteer. Oh, it's actually, I think my computer's going slowly here. So hit volunteer, be a hero, make a plan. Let's make it easy to talk about care planning, download our campaign toolkit. And so Mary just walked through what is covered in our toolkit, but here it gives you some background, what our goal is, and just, again, those different levels of how you can engage with this campaign.
Melissa, we see your PowerPoint screen.
Oh, you still see my PowerPoint? Okay, let me make sure you're seeing the right one. All right, can you see it now?
Yes.
Okay, so just let me backtrack. Sorry about that. So if you go on our website, npaf.org, volunteer, be a hero, make a plan, it'll take you to this page here. We have more details about just what it is that we want you to do for the campaign, but really everything you need is right here in our toolkit. So if you can go ahead and download that. And then again, this is something you can print out or you can save to your computer, and just provides just details about why we're doing this campaign, our goal, and again, the different levels of what you can do as a volunteer. And here specifically are those sample social media posts that Mary referenced that you can really just cut and paste and, you know, just copy that to either Facebook or to Twitter. And then here, of course, is the content calendar. And for the hero level of engagement, Mary mentioned, you know, we have our just email templates that you can just, again, copy and paste right into your emails when you're reaching out to, you know, businesses in your community or organizations in your community, even ones to your family and friends that you can personalize to your voice. And we even have scripts for, you know, if you want to, you know, do that hero level of sharing your story with us and posting a video. So yeah, so that's our toolkit, and we think it'll be your guide. If if you're going to engage in this campaign with us this month, just really show you what it is that you need to do. And again, if there's one thing anyone can do, it's to share our care planning guide. But this week here is the week that we really want you to take action. And so we'll be keeping track of that. So I'll stop talking now and hear what everyone has to say.
Does the toolkit have hashtags in it? We're going to use hashtag?
Yes.
Make a hero?
Yes, we just have our campaign hashtag, be a hero, make a plan. You can also hashtag care planning as well if you like.
This is Tony. I think I'm gonna probably need a little bit of help. It's been ages since I've been on Twitter, but to do that, I'll probably have to get my younger daughter to help me with that. Just thinking it's not something that comes normal for, I'm not used to Twitter anymore. So.
No, it's okay. Yeah, no, it's we also out in the beginning of the toolkit, we have some quick pointers on each social media page. So for Instagram, Twitter, and Facebook. But of course, if you need any help, you can always email me and we can hop on a call.
Yes, I think Jessica had also mentioned that Twitter is the hardest social media for her, which I think it's different for everyone. But yes, we are happy to help on that front.
Are there any platforms we cannot use? I mean, can we use TikTok if we're on TikTok?
Absolutely.
Okay.
What do you think, Mary?
Do a dance with
I've
it.
never been on TikTok, so
Yeah, you can dance with it.
Okay.
You have
Yes,
to
yes,
hold
absolutely.
your care plan up and dance it around.
Yeah, I have a TikTok channel. So.
Wow, impressed. So I have a question. Will this also be recorded just in case some of us cannot make that for the legend training? Would that also be recorded? Right.
Yes, yes. And we will include that in the weekly. So I can't remember if I mentioned this earlier or not, but throughout the month of April, every Tuesday, you should all receive a digest or weekly email from us for the campaign. So just to make sure that you guys are on the list, make sure to sign up. I believe it's dropped in the chat for the campaign specific newsletter. And you can also directly sign up for the legend training call as well today. Yes, you'll receive updates from us. A lot of updates from us.
Hey, Melissa, this is Tom.
Hi, Tom.
Hi, I'm not splitting hairs here, but when you had talked initially about the care plan, and you used the term medical, are you being inclusive of mental?
Yes.
Because some people don't do that.
Yes, care planning involves, and if you go into our care planning guide, we talk about how this is social, emotional, financial, all different types of ways you can, if you're sick, these are all things that impact your health, or I'm sorry, your life. So mental very much is included in that. So hope that answers your question.
Yeah, no, I just, I have to deal with statutes all the time with lobbying, and so many statutes separate mental from medical. That's changing, but so across the country, you've got bodies of law that talk about mental in contradistinction to medical. And I don't want to get into the weeds on that, but you know, I've dealt with people that have mental issues that are not necessarily designated as being, quote, medical. And there's always challenges with coverage, health coverage with mental versus medical. So
yeah,
I just want to throw that out. We couldn't see the material that you were scrolling to see
right.
if you had, so that's the reason I asked the question.
Right. No, I think it's a good question. And for us, care planning, again, it goes back to, you know, not just the clinical or the medical components that, you know, revolve around, you know, planning for when you get sick. Obviously that's a part of it, but we know that there are just so many different levels and layers to being healthy and taking care of yourself, and mental health is a component of that. Financial health, social well-being, all of those things are really important. So thank you for asking.
Melissa, you opened my eyes on this to an unmet need that was just not on my radar, especially thinking about how this is positioned as a prequel to an advanced directive.
Mm-hmm.
And I'm a cancer patient and I coach other cancer patients, and we lead a Southern California support group. And although all of those groups include both patients and caregivers, so often the focus is on the patient. And the patient will have the advanced care directive and may have had a good comprehensive discussion and have many of these elements,
Mm-hmm.
but oftentimes the caregiver is the one that is a primary caregiver for the cancer patient, but does not have these components done for themselves.
Right.
I'm thinking about all the people that I work with, and we're trying to put extra emphasis on support and resources and things to think about in planning if you're a caregiver. And maybe pushing towards that person, you can't do your job as a caregiver if you don't have your own plan in place. And I wasn't even thinking about, we talk about it, but I didn't really have any good resources to try and help people in that caregiver role build up a plan that is personalized to them, not about their patient that they provide support for. I'll have better work there than trying to get my young, invincible 25-year-old to do this, but I can get caregivers to jump on board.
No, I think it's exactly right. Like if I'm thinking of that first worksheet that I shared, that's a part of the guide, like what matters to you. And like that is so important for caregivers to communicate as well, because so many of them just identify in that, all the different things that they're ticking off to provide and care for their loved one, and putting aside the things that matter to them. And so I think having that worksheet and considering those different options would be really, really helpful. I'm curious to hear, if you do share a guide with this group, what the response and feedback would be.
We'll let you know. Thank you. It's good.
Thank you. Any other comments or questions?
I'm speaking for the third time, so I don't want to take up if other people want to talk, but I will just mention when my parents' health started to really go downhill, we were lucky to get access to a lawyer that updated my mom and dad's will. They created the advanced directives, and then they also created all the power of attorney paperwork. And there was no cost to my parents because it was a free service through the cancer legal line that state of Minnesota has. But sitting in that lawyer's office for that afternoon, going through all of the questions, which are similar to some of the things that you've included here, that gave me the knowledge base for me to update my own advanced directive. And so there really at times is an overflow from when you're helping patients to being the caregiver that thinks I better update my own stuff now. I learned so much from that afternoon in a lawyer's office, and it's come in handy through the years since then. And I will say that I come from a large family. There were 7 of us kids, and I don't know what I would have done without some of that paperwork, because as things got, through the years, we didn't agree. Us kids, we always thought, well, we'll get along and everything. But the paperwork really came in handy because we knew what our mom and dad wanted. And it was there in black and white. So just my own experience with this kind of stuff.
Thank you for sharing, Tony. And that's our hope here with, our care planning guide. Again, we see it very much as the prequel to those advanced care planning, documents. But I think our hope here is that it just, we think the most important part for care planning is, one, thinking about the things that matter to you and then communicating that with your loved ones. And we hope that this is a our guide provides an easy way and a threat or, a non-threatening way for people to approach these types of topics.
I just wanted to say something like kind of from a different perspective. I think it's important too, like that you guys are also having young people create a care plan as well, because young people don't really think about, oh, well, what happened? Like, I'm not going to worry about whether or not I don't wake up tomorrow or something. Like, that's kind of not what's going through their minds. But I have so many friends that have moved away from their parents, and I'm sure still in their mind, they're like, oh, well, my parents will just take care of me. But that's not always the case. I live 8 hours away from my mom, and she would not be my primary caretaker. It'd be my fiance. So I think that's really important to, like, that's something that I would kind of gear my friends towards when sharing this would be, hey, it's a care plan if you're in a mental health crisis, if you're in a health crisis in general, if you're at home and you cut your thumb off or something crazy, it's always good to have a plan. So that's kind of, I think, the avenue I'm going to go with it. Even I'm still going to help my family with it, but like more so trying to get my friends to see that point of view.
That's a really great perspective, Brittany. And I think that's something that will help normalize care planning conversations with everyone, especially within that youth demographic. Because I know a few years ago, a lot of my friends, my young friends would, not sign up for health insurance because their argument was quite literally, it wasn't, always about money, but their argument was quite literally, well, I'm young. I don't need to do this. And you also bring up an important point about, not everyone feels equipped to be in that kind of a position, regardless of whether or not you're a parent or a child, or even a nurse. I know Ashley Freeman, one of our colleagues, she runs our NPAF podcast. And this second season, she is highlighting caregivers and their experiences. And the most recent episode, she was speaking with a caregiver who's also a nurse. And she is caregiving for her father. And she said, even as a trained nurse, I wasn't fully prepared to be a caregiver. So that's definitely something very important that we want to make sure that we are getting that message across to everyone, and especially young people. The young invincible demographic, as Todd was saying earlier, that's very, very important. So I thank you so much for bringing that up.
Yeah, of course.
Yes, and that's, it's exactly why we've highlighted, young adults as one of those target audiences for us, because we think that this is, as it is like with signing up for health insurance, they should also have a plan. And I think, again, it was, COVID that really underscored that anyone and everyone should have a plan in place. And I think this is, again, like Todd, approaching his group, I'm eager to hear what feedback you'll get from your friends, Brittany, about this process. So thanks again for sharing that. And, I do want to also mention that there is another, apart from young adults, patients and caregivers, we have another target audience there of our underserved population. And, these might be people who won't be finding this resource by going onto our website. And so we're really going to call on you all as our volunteers to bring this resource to them, whether it's something that you might be able to print or, have available in local libraries or local, free clinics, because we think everybody, again, should be prepared. And so we'll be eager to hear those ideas of how you would want to, try to reach those different audiences as well.
And yes, and I want to say something as a clinician. Sometimes when it comes to care planning, we all, regardless of our age, we're young at heart when it comes to care planning. I mean, seriously, as a clinician, oftentimes, you don't recall, working with a lot of different patients and just even yourself thinking about your own mortality. And the COVID area really made us think about that. So I think what you guys are doing is awesome. I think that it will make people realize that you don't need an attorney, because oftentimes when people are thinking about care planning, they thinking about, can they afford it? So what you guys are doing is saying, okay, you can do this, this, and that, and you don't need an attorney. So that within itself is going to help a whole lot of people. So I'm really excited. And what I plan to do is to try to put this information out in barbershops, beauty shops, whatever. Just get this information out as to many young people as possible. But I want to be clear, when it comes to something like this, it's not about the age, the number. It's about can it happen to me and when. So I just think what you guys are doing is so awesome. I'm just excited about it. Thank you so much.
Thanks for sharing that, Tammy. And I think you bring up such a good point. It's, you know, people either they're afraid to face their own mortality and don't want to think about those things, and you know, therefore are young at heart. But yes, I think I'm eager to see again, like, you know, where you bring this resource to, what the response will be. So thank you for sharing that.
I don't want to cut anybody off here, but I just had a quick question. Are you guys going to do like a shareable post on Instagram under NPAF to where I could just like share it to my story? Okay, cool. That's my question. Thank you.
Yes, yes.
Also, Melissa,
Mhm.
are you going to do a shareable letter or email that we can use?
Yes, so that
Okay.
that email is included in the toolkit. So if you download the toolkit under, like, if you want to share it out to share our resource to local, you know, businesses, or even just other organizations where you have your, you know, your spheres of influence, you can use that template, personalize it to your voice, and you know, I think our resource is already linked there, so you should be able to do that quite easily.
One quick note, I know we still have some time, but I want to make sure that we are really serving you the best way that we possibly can. So we ask that you take this survey. It'll take, I don't know, a minute maybe, super quick survey, just to let us know exactly how you intend on participating in the campaign, if the way that the information was presented was helpful at all. And, you know, there will be a section that says comments or questions. So if there's anything that you think of between now and the end of the month, whether it's a resource, frequency and communications and resource sharing, we are very open and receptive. We want to make sure that we get as much feedback as possible to continue to improve on this campaign. And of course, we want to make improvements along the way this month as well, if you can think of anything.
All right, so I think you guys are welcome to just chime in with any other questions, comments you have, but just some key dates for you to mark. Our next webinar is a week from today, our Legend training on April 8th. Again, that week where we want all of you to be showing up on social media is April 12th through 16th. April 16th is National Healthcare Decisions Day, so we will be looking specifically for your faces and why you decided to start your care plan. And then at the end of the month, we will do a wrap up. You know, we are going to be tracking, you know, what's showing up on social media. Are people talking about care planning? We're going to, you know, of course, keep track of like the Twitter chats. We're also going to, you know, look at, you know, how many people are downloading our resource, how many people are being driven to our website. And we're going to, you know, share, you know, if you're part of our, or if you've already signed up for our newsletter, our campaign specific newsletter, you'll be getting these little tidbits as the month goes on. But that last wrap up call will bring all this together, bring all your efforts together. We want to make sure that we capture the legendary work that you guys are doing in your communities. And so again, we'll just all come back together on the 29th. And let me see, I think here, you know, so often we hear from our volunteers and they're just so eager to do something. They're like, what can I do today? And so this is what you can do today. If you haven't already, again, sign up for our campaign newsletter. That's in the chat. I believe Mary dropped the link in there. Register for our Legend training. And if you are on social media, please copy this post here, post it onto social. Mary, I'm wondering if we can just copy this and post it into the chat too, if that might be easy for people to cut and paste from there. And we want to start that conversation about care planning today, and that's going to continue throughout the month of April. So those are some actions that you all can do right now. Any other comments, questions, those we didn't get to hear from? Want to make sure you have a chance to share feedback as well.
Yes, I was going to say, when you was talking about the care plan earlier and it reaching the younger population, what I hear most of the time is they think that it's kind of like a complicated deal. You know, when you think of care plan in the healthcare field, it's more like, you know, you need a doctor, you need a clinician, and you need a lawyer. But the way the template is set up, is in simplicity, it makes it much easier to promote to them, you know, and just showing them the worksheet in the way that, you know, you even have the PDF set up, very easily accessible. And it makes it easier for us as, you know, volunteers to kind of promote it and say, you know, hey, this isn't as technical as you guys think it is. You know, here's a template, colorful, bright, and let's do it. So I really love the idea of just a simple template and asking the direct questions so that they'll have an actual care plan when they're done, not even realizing that that's what the process that they're going through. So yeah, I really, really love it. And I think it'll touch, you know, different populations, you know, the older population, underserved, and the youth.
Yes.
So yeah, I love it.
Great. Thank you for sharing that. We were very intentional about how we created the guide, because we hear from people, whether it's, our volunteers like you all sharing your experiences, but, they talk about how complicated it is, and we wanted to simplify it and make it not so overwhelming or scary. And again, for me, my background is in public health. I think a lot of you know that. And so I was actually I wanted to mirror what I've been seeing in like the emergency preparedness work that's done, and how could those types of plans and those, things that people, they know to have their go bag, they know to do X, Y, and Z if a hurricane's coming. What is it that people can do to prepare for, the unexpected as it relates to their health? Whether it's, even, maybe getting into a car accident or, getting diagnosed with something or a serious illness. Those are things that they're scary, but I think if COVID taught us anything, is that anything can change in the drop of a dime, and we just need to be prepared. So yes, Jamie, thank you so much for sharing. All right, any other final thoughts?
Is it okay to do screenshots? Like if I do a screenshot and post it from today, we have any problems with that?
Oh, no, I don't think so. You can,
Okay.
yeah, and just, I would say, get our link out there as much as possible. That's what we want people to see.
Okay.
All right. All right, guys. Well, we have about 4 minutes left as far as I can tell, but I think hearing no other comments or questions, please go out there, be our best, be our ambassadors, be our heroes. And we look forward to connecting again. I think maybe next week if you're going to be a part of our Legend training.
All right, thank you.
Thank you. Bye.
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 Thank you, guys.
Bye.
Bye.